PCOS has potentially many impacts on infertility. I think the main thing is many women are under the impression that they have PCOS and they're therefore going to have difficulty getting pregnant. And I want to convey that message that is not necessarily true. Many women will get pregnant and didn't even know they had PCOS. So I don't want a woman to feel that because she has PCOS, she's going to suffer with infertility. I think that's a very important message. PCOS is a common condition, and it has a spectrum of presentations. But the main issue is that the woman has a difficulty with ovulation in some instances, and that can generally be overcome with some lifestyle interventions. Sometimes some women with PCOS tendency to a little bit overweight, particularly weight around the waist, so potentially some exercise and dietary advice. A low GI diet, a calorie restricted diet may assist with ovulation. Sometimes some simple intervention with a tablet called metformin, which is a drug that's often used in women and men with pre-diabetes, and that can cause the cycles to become more regular, cause ovulation, potentially reduce miscarriage, and has a very good impact on her chance of conceiving. More recently, there's been interventions with a drug called letrozole, which is a very simple medication to assist with ovulation, and something that our unit is very proficient at and has great expertise and has published in the literature on is the use of gonadotropins. These are injections which are very easily administered by the woman to herself. But what is crucial in this journey is that she is monitored closely, because it is essential that when we push the ovary to release one egg, that we only get a singleton pregnancy. In our expert hands, ovulation induction is very safe, very effective, and producing an excellent result for the couple. Beyond simple ovulation induction, some women will need further treatment. Perhaps she has blocked fallopian tubes, or a partner's sperm count is impaired, and therefore she might need what are traditionally called assisted reproductive technology. IVF, some patients will be suitable for, but something that we have world-renowned expertise in is in vitro maturation of the oocytes, or IVM. IVM is what appears a very straightforward approach, but our skill set really is in the laboratory. We just give the woman a few days of injections and collect the eggs early in their journey of development. We take them, we mature them in the laboratory, and only a day later do we ask for the partner's sperm to assist with fertilization. So the woman is therefore having a much more less challenging medical approach. She has her eggs collected, but rather than getting overstimulated and a risk of a dreadful condition called ovarian hyperstimulation syndrome, she has a much curtailed journey, much safer. And in our published evidence, we show that it's just as effective as traditional IVF in terms of the outcome. And we're one of the only few centres in the world that do this. So IVM is a fantastic innovation for women with PCOS. Other things that women with PCOS may be compromised with is potentially increased risk of miscarriage. Again, simple lifestyle interventions can help, metformin can help. She may also be at greater risk in pregnancy of gestational diabetes and potentially preeclampsia. So again, getting healthy for pregnancy, which is something at fertility specialists we are really very firm on advocating. That will assist their conception, reduce the risk of miscarriage, and produce a more successful and pleasant pregnancy, because unfortunately with gestational diabetes, the woman is obviously having to check her blood sugars regularly. So PCOS, I really want to convey the message is it shouldn't be seen as a substantial burden to the woman. Yes, it needs to be identified, treated appropriately, but these women should be reassured that their chances of a successful live birth of a healthy baby is excellent.